Hello, everybody, and thank you for the opportunity to be with you on World Obesity Day. I wish you greetings from Lutruwita or Tasmania, and I'd like to acknowledge and pay my respects to the traditional owners here, the Palawa people. My name is Roscoe Taylor. I'm a former Chief Health Officer in Tasmania and Director of Public Health, and have taken part in a number of attempts to improve our obesity initiatives in Australia, and so my background is in the implementation of prevention at the population level. On World Obesity Day, I want to throw my weight behind just one single prevention challenge, and that is the problem of massive overconsumption of sugar-sweetened beverages, particularly in childhood and adolescence. Now, health promoters often talk about making healthy choices the easier choices, but for success in dealing with complex multifactorial issues like obesity, where our obesogenic environment often denies or undermines choice, my experience has been that we must also develop strategies that make unhealthy choices harder. We need to change the tax arrangements on sugar-sweetened beverages, and we need to do it now as a priority. This will not on its own be a magic bullet, but in my view, it is essential. It's really hard to go past a policy initiative that the evidence already shows will be effective and rapidly so, that will improve health equity and be achievable. Now, with sugar and sugar-sweetened beverages taxes, it's not widely appreciated that historically, prior to the introduction of GST in Australia, the sales tax on sugar-sweetened beverages in Australia was actually 22%. So the advent of GST was probably a windfall for some fizzy drink manufacturers. My preference would be to see the introduction of at least a 40% levy to maximise the health benefits and also bring home parents especially the message that discretionary foods like sugar-sweetened beverages should be in the category of special occasion drinks and not a daily habit. In terms of governance and how to go about this, my preference would be to re-establish the Australian National Preventative Health Agency that was abolished by a former government and in 2014, and they also attempted to abolish a legislation that went with it. But that legislation actually still exists, and it's a prime opportunity now for governments to reinvigorate that and task it with developing the best ways of going about introducing a levy, a health levy, or a new tax on sugar-sweetened beverages. Now, I wish you all in the Obesity Collective well, and thank you again for the opportunity to take part.